There's a lot of people there who say that they won't have it. What do you make of it?
I wouldn't say that they won't. They're not saying they won't have it. They're saying they're waiting for information about it. Look, and I don't blame them. At the moment, we're still waiting for more and more information. We're in a particularly great position in the world to actually see the rollout of the vaccine in other places and see how it works. So that doesn't surprise me. But I actually think Australians are keen to go back to normal life. So I think that as it gets rolled out, we'll probably see a much higher acceptance rate than what that survey is showing.
So based on that, Charlotte, I mean, would you be suggesting that people hold off rather than rush out and get the jab?
No, I'm not saying that I'm suggesting that people hold off. At the end of the day, we're not rolling it out tomorrow. We're rolling out Pfizer next week. That's going to be a fairly slow rollout. And then the AstraZeneca is also going to have a sort of a fairly staged rollout. So I think people have got time to consider. And even 4 weeks is a really big amount of time at the moment in terms of numbers of vaccine being rolled out internationally, the data that's coming in. What I'm seeing about AstraZeneca is that it's safe and it's certainly really going to provide us with what we want, which is protection against severe disease. And it looks like it's also going to protect us against transmission. That's brilliant. So, as I said, I'm happy for people to see the data as it comes in and to make a really good considered decision and talk to their GPs. GPs are in a great position to be seeing the information as it's rolling out. As I said, if there's more information coming in every
There are
day.
concerns, though, particularly from AstraZeneca, that the vaccine, that the virus can eventually become resistant to the vaccines, and they're kind of working on ways to adapt to that at the moment. Would you have concerns about that?
Think about the flu. That's what happens with the flu every single year. We get a new flu vaccine that adapts to the changes in the flu vaccine. But what we know is that your baseline protection is sort of kept higher with having sort of regular vaccination. So I think having the first AstraZeneca protects us against certainly the virus that's in this country. It looks like it's also protecting for the UK variant. It's the South African one that there's concerns about at the moment. Yep. Aren't we lucky? The technology is trying to be there to keep us safe at all times as it goes forward.
So it's an evolving thing.
Yeah. And I think, as I said, Australia has got the most amazing team of public health physicians and immunisation advisors. So we will make sure that whatever happens for the Australian public keeps us as a nation able to function and start, having more people come back and for us to be able to venture forth into the depths of COVID.
You're still going to have a lot of people who don't want to get the jab, and it's not just anti-vaxxers. There are people who just don't want to get it full stop for a different variety of reasons. They're concerned about the speed of the rollout, et cetera, et cetera. You'd be expecting that, right? And is there a limit to the amount of, a percentage, I suppose, to the amount of people that you would hope wouldn't take it, that would still allow the rest of the nation to have it, and then it kind of be okay?
Look, I'm, as a GP, my hope is that we can get the vast majority of our patients across the line, particularly who are vulnerable. What's very interesting is watching in Europe, where there is actually now a lot more deaths happening in young people, because they're the people who are not necessarily taking it seriously.
Yeah.
And so, again, I think we just need to look at what's happening, make a decision for ourselves, but hopefully as we progress down more information and a better understanding of what that looks like, more and more people will take it up. And I can't, speak for what is going to happen in that sort of information and how people feel informed. But I promise you that as information comes to hand, people will be able to do it. In terms of numbers, sorry, you did ask me that. Look, that we always talk about this herd immunity, which is we know that if we can try and get at least 70% effectively protected, then we're looking good. So if you think about what that means, that's a lot of people.
How's the rollout, Charlotte, going to work for GPs?
Great question. We're not all that sure at the moment because the details haven't actually come out yet. What I can tell you is that the practices that fulfil the requirements have put their hands up to say they're willing to be part of it. And now they're next waiting to be told yes, this is what we need you to do. The practices behind the scenes are basically planning how many rooms will they be able to dedicate to vaccination, what are their systems, who are the patients they need to contact, and what's the scheduling for it. There's a huge amount of planning happening, but the fine details will emerge as the government basically lets us know how they're going to put out the vaccine. Bottom line is, I can be as well planned as possible, but if I don't actually have the vaccine in my vaccine fridge, I can't.
Sure. So presumably, once you get your supply, or once a GP gets their allotment, I suppose, for their practice, then what, they just give themselves one, or is a nurse on hand to be able to provide one? How's that going to work?
Well, again, there's a whole lot more than just having the vaccine in my fridge. We need to have all the sort of process, exactly as you say. So who gets allocated to have it? Certainly all other healthcare workers are designated to get the AstraZeneca sort of vaccine. But what that looks like in terms of who gets it first, we haven't actually been given that level of detail.
Yeah.
All the frontline staff will get Pfizer. Everybody else gets AstraZeneca through general practice.
Okay, all right.
Hey, all the hospitals.
Charlotte, thanks for your time this morning. We've got to go, but thanks for your time this morning. Really appreciate that. We'll talk to you again soon.
Thanks.